Great. Okay, well, thank you everyone for your patience. Thank you for being here today. Just a couple of ground rules here today on Medicare. This is just an introductory. I know you'll have, Suzanne sets up the actual Medicare at UCSD, where the health experts there that
May
are
I
most
jump
familiar.
in here, Ryan? We already
Yep.
did that seminar, and when we send out the video of this recording, we will send out the link to that seminar as well, which is already up on our YouTube channel.
Perfect. So the goal today here then is to give you a background on Medicare. I'm not going to belabor this presentation too long. We'll be done here in about 35, 40 minutes as I fly through the slides. But the goal here is simply to get you familiar with the background of Medicare, what Medicare is, what it's not, what it covers, what it doesn't cover, how it works with the public-private partnership, and so on. Next slide, please, Vanya. All right, so 3 key points. Next slide, please. If you don't enroll Medicare on time, something that almost everyone does, but if you do not, there is a monthly penalty because the system doesn't work unless everybody's part of it. Next slide. Secondly, if you do not get the right private insurance to go with Medicare, you may pay too much in premiums or out-of-pocket costs. I think this is really important. This is something that as you go through retirement, you're going to need to adjust and think about every year as you're looking at your different needs, your different health experiences, each of them individualized, and whether a Medicare Advantage type plan or a Medigap plan is more appropriate for your supplementing your public partnership. Next slide. Not planning for higher healthcare costs. We'll go over some numbers that you can expect. You could run out of money or not be able to get the care you need. We'll talk about how much an average couple will spend in retirement on healthcare. Next slide. Let's talk about Medicare. We're going to start out with what is Medicare, who needs to enroll in Medicare and when, and how do you enroll in Medicare. Next slide. So the second part of this presentation is we'll talk about how much it costs, what does it cover, what does it not cover, and how does the private insurance work with the public insurance, the private-public partnership that is Medicare, age 65 and above. Next slide. So in the third part, we'll talk about 2 reasons your healthcare expenses will be higher in the future. We'll go over some inflation, increased need for services, and we'll just briefly touch on long-term care. I know Jody Hubbard used to always do the presentations on long-term care, and I'm sure Suzanne has a very competent person now running that part of the program as well. So I won't go into too much depth, but we'll go over a couple key things with long-term care that you should be thinking about. Next slide. All right, Medicare enrollment, part 1. Next slide. All right, so who pays for healthcare in the United States before age 65? As many of you are familiar since you're part of UCSD, you have your employer group health insurance plan. You definitely have COBRA, which just stands for Consolidated Omnibus Reconciliation Act, I believe 1985 or 86. That's just insurance after you leave an employer to gap you prior to Medicare to another employer or to signing up on one of the exchanges. You have individual health insurance, right? Like I have for my company where I provide health insurance to all the folks that work with me. You have retiree health insurance, and then down in other, for those of you like myself that are military veterans, retired military, you may have TRICARE or something to that effect. After age 65, Medicare becomes your primary payer in most situations, unless you continue to work, and we'll go over the rules around that, right? So you're exempt if you have an employer group plan that covers 20 or more employees, and it's called creditable coverage. Okay, UCSD is considered creditable coverage. So if you're in this presentation right now and you're still working, you're over age 65, and you're saying, hey, I haven't had to sign up for Medicare yet, although I believe they do still want you to sign up for Medicare at 65, so you get your free Part A through UCSD. But if you are in the private sector, you may not be on Medicare over age 65 because of that credible insurance. And then your other insurance pays second, and that's what they usually do, UCSD. Next slide. So what does this mean for you? Unless you are covered by an employer group plan that covers 20 or more employees, meaning creditable coverage, you must enroll in Medicare when you turn 65. Next slide. So what if you don't enroll in Medicare on time? Well, there is actually a penalty, a pretty severe, large penalty if you do not enroll, and we'll talk about enrollment periods here in a second. Your healthcare expenses may not be covered by insurance. There may be a gap between when you're supposed to sign up for Medicare and when you actually sign up if you don't sign up on time. And then you won't have any coverage, any form of coverage during that time period, potentially. And then private insurance options may be limited, meaning you may have some limits on pre-existing conditions if you do not sign up. I'll tell you right now, in your initial enrollment in Medicare, there are no pre-existing condition exemptions. So that's definitely the time when you want to get set up and you want to know exactly what you're getting into. Next slide. So what is Medicare? 1965, right? The National Health Insurance Program for people age 65 and over. Those of you that are familiar with payroll taxes, you have your FICA taxes, right? Your OASDI taxes, right? Old Age Survivor Disability Insurance, which is Social Security. And then in 1965, we added HI, which is your health insurance. You may be familiar with your Social Security wage tax is 6.2% on the employee side. That's matched by your employer, unless you're self-employed like I am. And then we pay both sides. And then you have your up to 2.45% for Medicare, and then that's matched by your employer as well. And whereas Social Security has income limit on the amount that you contribute to Social Security wage tax, Medicare is unlimited. So if you make $1 million a year, $1 million, you're going to get that Medicare tax. So it's a little different than Social Security from that standpoint, that you continue to pay tax on it, and there's no cap or wage cap like there is for Social Security. It's administered by the Centers for Medicare and Medicaid Services. And enrollment, as most of you probably already know, is through SSA and Social Security Administration. Just simply on the website, there's a button there that you can say is enroll in Medicare. And if you do come to the Social Security presentation and you take my advice of trying to delay or at least maximize your Social Security benefit, you will be familiar with the fact that, my recommendation is that you have to pay Medicare out of pocket prior to claiming your Social Security benefit. Once you've claimed Social Security, your Medicare premiums are already taken out every month from your Social Security check. Next slide. So who's eligible for Medicare? Everyone over the age of 65, all U.S. citizens, legal residents who've lived in the U.S. continuously for at least the last 5 years, and some people under 65 who are eligible for Social Security disability. If you are on Social Security disability or eligible for it, you can send me an email privately, and I'll tell you what the qualifications are for Medicare. Next slide. So here are the 4 parts of Medicare, just to clarify all the confusion that comes with Part A, B, C, D. So Part A and B are the government part of Medicare, right? That's the public partnership of the public-private partnership, right? So Part C is simply Medicare Advantage. The next slide we'll go over kind of how it works, but I want you to think of C as encompassing everything. And then Part D is your Medicare prescription drug is your PDP, as we call it, or prescription drug plan. And then traditional Medicare would be Part A, B, D, and then a Medigap plan. And we'll show that on the next slide here. Next slide. This is a little harder to read, so hopefully you're looking at it right there on your computer. You can blow it up. But on the left side, we have the original Medicare, which is Part A, your hospital insurance. Part B, your medical insurance, your doctor visits, all those things. Then you have Part D, which is your prescription drug plan, okay, which is something you also have to do a bunch of research on to make sure you get the right coverage. And then you add on what we call Medicare supplemental insurance, or more commonly known as a Medigap policy, okay? Now, remember, the first time you sign up for Medicare, this is really, really important to understand, okay, is that there are no pre-existing condition exemptions on any plans whatsoever. That cannot be said subsequently after the initial enrollment. So it's important that you make a decision, when you make a decision in initial enrollment, that it's one that you're thinking about your health, not just for this 1 year, but maybe going forward, thinking about family history, things like that, when you take into consideration what type of coverage you're looking to get. And then you have the other side, which is the Medicare Advantage plan. An example would be the Kaiser plan in the UCSD program, and that incorporates everything, right? A, B, your prescription drug plan, and instead of having a Medigap or Medicare supplement insurance plan, it's just all encompassed under one, under the Medicare Advantage or Part C. Next slide. So how do you enroll in Medicare? If you're receiving Social Security when you turn 65, right? A and B are automatic. Coverage starts in the first of the month you turn 65. In Part C and D and your supplement plan, those are the ones that are the private partnership that you have to select and proactively enroll in each year. Next slide. So if you're not receiving Social Security when you turn 65, as I discuss all the time in the Social Security presentation, you got to sign up on your own through SSA during a Medicare enrollment period. And then you have these 3 different enrollment periods: the initial, special, and general enrollment period. So let's go over those real quick. Next slide. So this is the initial enrollment period. If you turn the month you turn age 65, so My birthday's next month in November. Let's say I was turning 65. So I would want my Medicare to start on the first day of November of my birth month. So I would want to sign up the 3 months prior to the first day of the month of which I turned 65. Okay, my birthday's on the 26th of November, but I would want to sign up sometime in October, September, or even August prior to, and you can see on the left there, then you'll have no delay whatsoever in your coverage. If, on the other hand, I waited or I put it off or there was something, I'm out of the country, whatever it happens to be, then there's a delayed start period. It's still part of your initial enrollment, still no pre-existing condition exemptions, but it's a delayed start, and it will start on the first day of the month that you actually enroll up to 3 months after your birth month of, or your 65th birthday month. Next slide. So who signs up for Part A during initial enrollment period? Almost everyone that turns 65. I believe this includes all UCSD employees as well, even if you continue to work. Again, check with your benefits administration if still working. In the private sector, say you worked at Qualcomm or something like that, more likely than not, you would not be signing up for Medicare at age 65 because you would stay on your employer plan. Although some employer plans, actually several of them, do still want you to sign up for Medicare because they want the Part A free coverage. All right. One thing to think about here, if you do have a high limit deductible plan and an HSA, once you have signed up for Medicare Part A, you can no longer contribute to the HSA. It does not mean you cannot use HSA funds to pay on a pre-tax basis for benefits or for a Medigap policy or Medicare Advantage or a prescription drug plan. It just means you can no longer contribute to the HSA and take the deduction. Next slide. So who signs up for Part B during the initial enrollment period, right? People are not covered by a comprehensive plan. So again, don't have the credible coverage, not working, self-employed, on COBRA, employed by a company with less than 20 employees. If you're receiving retiree health benefits, UCSD, you know that the plans change a little bit between when you're active. Let's say you retire at 62, go to retiree plan, and then you go on to the different Medicare plans at 65. And employed by companies' health plan is less comprehensive than Medicare. You're obviously going to want to sign up for Medicare if you qualify. Next slide. So who signs up for Part D, which, if we recall, is the prescription drug plan? Well, people sign up for Parts A and B and want prescription drug coverage either now or in the future, right? They must sign up when first eligible or face late enrollment penalties. So you have to remember, not is it just Part B, but Part D, you could potentially have a double penalty if you do not sign up on time. And then there's two options on Part D. There's that standalone prescription drug plan, which is the traditional Medicare route. And then there's the Medicare Advantage plan that would potentially include drug coverage. And that, again, is part of the private partnership. So that's what you each and every year are going to have to review when it comes into that enrollment period, which we're getting into right now. You need to review it on your own to make sure that your coverage hasn't changed, especially if you're in a Medicare Advantage plan. They may change different coverage for different, drugs, and you want to make sure you're following up with that each year to make sure the plan is not changed and it'll affect, what is afforded in the plan and what is not. Next slide. So then there's the special enrollment period, and this is for people who do not sign up for Parts B and D during their initial enrollment. And mostly this is for people in the private sector that are working. They have very comprehensive insurance. Let's say they work for Microsoft, like several of my clients do up in Tahoe area, or Tesla or something like that. And they have very, very good health coverage, and they're not required to sign up for Medicare. So then they become part of the special enrollment period. The special enrollment period for Part B is any time before your coverage at your private employer ends, right? Or the 8-month period starting the month of group coverage ends. So you got an 8-month window instead of that 3 months like the initial enrollment. And if for whatever reason, Congress in all of its wisdom said, we're going to make this as confusing as possible. So in this special enrollment period, we're going to give you 8 months for Part B, but we're only going to give you 63 days for Part D. No idea where they came up with the number 63 and why 8 months. Just the best solution here is if you are in the private sector or you have a spouse in the private sector that's not covered on your UCSD, or whatever it happens to be, make sure you are enrolling in Medicare and the special enrollment period prior to your departure from your current employer. Next slide. So again, to avoid the late enrollment period, sign up during the initial or special enrollment period. If you don't do that, next slide, this is what happens. You go into the general enrollment period, which I call the penalty box. So if you miss the initial enrollment period, right? Then you can sign up during the general enrollment period, which is January 1 from March 31st. Problem with that is coverage doesn't start to July 1st. So if you sign up in January, February, March, as you can see, you're not going to have coverage for several months. Something you certainly don't want to do. It's why I call it the penalty box. Don't wait for the general enrollment period. Next slide. Just a review there of the 3 different enrollment periods that we just covered. Next slide. How to sign up for Medicare Part A and B, very simple, ssa.gov, just push the button there, or you can call Social Security on the 1-800 number. And if you want, general information, Medicare.gov is actually a really good resource. Some pretty plain language in there about stuff I'm going over in the presentation and in just general Medicare eligibility. Next slide. All right, how do you sign up for Part D? Well, you have to decide again if you want original Medicare or Medicare Advantage. Remember, that's 2 different ways that you can get your prescription drug plan. If on original Medicare, you got to shop for that standalone prescription drug plan. And then if in Advantage, it should have drug coverage, but you want to make sure and you want to understand the plan. Next slide. So let's get to Part 2 here, kind of flew from Part 1 there. Let's talk about how Medicare and private insurance work and go over some of the different costs associated with it. Next slide. So premiums are nearly half of Medicare beneficiaries' out-of-pocket health spending. This is a little bit old, 2016, but the average out-of-pocket spending on services and premiums among traditional Medicare beneficiaries. I'll just leave this slide up for a little bit, or you can go back and review it, after this is posted to YouTube. But you can see their services 58% and premiums account for almost half, or about 42%. Average total out-of-pocket spending in 2016, which I would say we're probably 50% higher, if not more now. Almost 5,500. Next slide. The out-of-pocket costs paid by Medicare beneficiaries. When I say Medicare beneficiaries, I want to think of all of you that if you qualify for Social Security, you also qualify for Medicare, right? Well, you got the Part B premiums that you're paying every month, right? You have private insurance premiums for either your prescription drug plan and your Medicare supplement plan or your Medicare Advantage plan. And then your other out-of-pocket costs are your deductibles. There's a portion that Medicare doesn't cover, that of a doctor's bill, let's say, or a visit or an outpatient service or whatever it happens to be. Service is not covered by Medicare. Again, that's why we have these Medicare supplement plans or Medicare Advantage plan, because we want them to cover as much of that as possible. Next slide. So monthly premiums. Well, Part A, you pay to Medicare. Again, if you qualify for Social Security, meaning you have 40 quarters, right, 10 years of employment history, where you're covered by Social Security, then it's 0. If you don't have full coverage under Social Security, 30, 39 quarters or less than 30 quarters, you can see Part A becomes pretty expensive on a monthly basis. Could be an encouragement to work a little longer. I know no one wants to hear that, but it will significantly reduce your potential Part A premiums. Part B premium was $144.60 a month in 2020. I know it's higher in 2021, and I'm sure in 2022 it's significantly higher. I would expect it to be even more significantly higher in 2023 due to the inflation that we're experiencing right now. That being said, we are probably looking at the single biggest COLA adjustment to Social Security since the Carter years, probably, due to the inflation, the rampant inflation that we've been experiencing over the last year. So Social Security beneficiaries, whether you are claiming currently or you expect to claim in the future, remember, you still get the COLA no matter what. So if you're not claiming right now and you're going, I'm not going to get the COLA if I don't start Social Security, don't think that way. You will get the COLA. And right now, from what I'm reading, we're looking somewhere in the high 8% range for the COLA and Social Security, which I will remind you, and this is a little bit of a teaser for the Social Security presentation that I give later this week, and why the value of Social Security is so important. If you think about your pension at UCSD, you get the first 2% COLA to match CPI, and then after that, I believe you get a quarter for every percent beyond that. So your UCSD pension doesn't keep up nearly as much as the COLA within Social Security. And that's why I always tell UCSD folks that are eligible for Social Security, it's an incredibly important part of your retirement because of the inflation protection. That other wonderful part about Social Security, and I know I'm kind of getting off Medicare here a little bit, but really important to note is that it's not taxed in the state of California at the state level, right? It's not taxed at all, not subject to income tax in the state of California. That's what makes it very, very valuable for all of you retirees. It's that extra little bit every month that can make a difference, right? So Part B premiums, we discussed that. I want you to notice the little line underneath both Part B and Part D. It says, plus the income-related monthly adjustment paid to Medicare if applicable. Well, that's going to be really important. That's called the IRMA, the income-related monthly adjustment, and I want you to take note of it. I have a slide coming up here that goes over it because that's what really shocks people. They don't understand why they get that attached to them. I see Chris shaking, nodding her head up and down because she knows, because we've discussed this privately a couple times, but it's based off of your adjusted gross income off of a previous year's tax return, and we'll go over here in a second. Next slide. So here's your Part B and D, including income-related monthly adjustments. And I'm going to leave this slide up for a little bit because I think this is one of the most important ones on the entire slide deck. All right, so look at your modified adjusted gross income joint there. It's the second column. And many of you are familiar with adjusted gross income. You may not be familiar with modified. Modified just brings in tax-free interest from municipal bonds. There's no item there. And it brings in half of your Social Security income as well. So most of you are probably going to be, under the 174,000 level, but maybe not. Maybe some of you are 174 to 218 or even higher. And you could see you get these added Part B and Part D income-related monthly adjustments. Go down to modified adjusted gross income of over 750,000, and you can see your Part B related monthly amount addition 347, and in Part D 7640. That takes your Part B and D premium bottom right there up to 608. And this, of course, is a couple-year-old slide, but $608. And that's for both. If you're married, obviously modified adjusted gross income for a joint, so you're filing with someone else. If you're married, that's significant because it's both of you, right? It's not just on one person. So how do you get into a situation? Well, many of you say, well, I don't make more than 750,000. That's not my. Well, what if you sell your home and you move somewhere, right? And you have a very large capital gain. That will be considered, because remember, California does not treat capital gains as capital gains. California treats everything as ordinary income. Dividends, capital gains, long or short term, it's all ordinary income. And so it goes right there into that modified adjusted gross income. So this happened to my mother when she retired. She moved from Silicon Valley down here to San Diego to Carlsbad, and she sold her home in Cupertino, had a very large capital gains. She's single at the time, and she got tagged with she actually sold at 63, and she got tagged with the income-related monthly adjustment. Now here is a little, as we say, a foot stomper in the Navy that you want to remember. If for some reason you do have a large capital gain, and again, this could not just be real estate. This could be turning over a portfolio a lot. You're trading, doing whatever. Lots of sales and securities could bump you up into these higher income-related monthly adjustment figures. But what happened to my mother is that we had to go and take her tax return from her 64th year and show it to the Social Security Administration, and then they readjusted her income-related monthly adjustment back down because she was able to prove that her income was not the same. So very, very difficult. Obviously, don't want to go through that. Something to think about, though, as you get towards Medicare and those retirement age. So I will leave that slide up for a couple more seconds. If you have any more questions on the IRMA, please don't hesitate to reach out. But I think the number one thing that people forget about is the sale of a primary residence. Yes, if you're married, you get a $500,000 exclusion on a gain, but many of you have probably been here in San Diego for 10, 20, 30 years, and I'm guessing a lot of you have more equity in your home than $500,000. And I don't mean equity, I mean the home is appreciated more than $500,000 above your basis. That's what's really important. Okay, next slide. So here's another expense associated with Medicare, your deductibles, right? Your Part A, you're going to pay $1,408 per spell of illness. Part B, the deductible is $198 a year, which is waived for some preventative service, flu shots, mammograms, pap smears, obviously COVID shots, bone mass tests, prostate screening, stuff like that. Now remember, this doesn't mean you're going to pay this necessarily. This is what you want to get supplemental coverage for, or Medicare Advantage that would cover this stuff. And your Part D is $435 a year. Next slide. All right, so co-insurance. Well, Part A, you have $352 a day for days 61 through 90, $704 a day for days 91 through 150. Skilled nursing, God forbid you have to go to a skilled nursing facility, $176. Remember, Medicare only pays up to the 100th day, and that's if you're showing continual improvement. If the doctors feel like you're not showing continual improvement, then you're considered long-term care, and then you have to have long-term care insurance to kick in, which most likely has a 90-day deductible, a time deductible instead of a monetary deductible. So these are things you need to think about as you put together your retirement health care, not just your Medicare and your supplement plan or your Medicare Advantage plan, but also how your long-term care plans and working with your long-term care advisor on how that works if you somehow have some type of situation. I'll say personal experience. I know Suzanne hates this presentation because it's kind of a bummer, but just from personal experience, my mother is only 71 years old, and she has gone in the last 12 months, has deteriorated pretty rapidly mentally, and we are working our way through this right now with Medicare. And unfortunately, my mom dropped her long-term care about 8-10 years ago, just due to the premiums increasing so much. So it is something you certainly want to have a conversation, not only with your spouse about, but if you have children that are in your life that will be there for you, particularly if you are a single parent or a widowed parent, I would certainly have that conversation with your children because they're going to be the ones that are stepping in, like my sister and I are for my mother. Part B, assigned claims. Again, 20% of Medicare approved were 8 unassigned claims, 20% plus the balance of any other additional charge the doctors may charge. Next slide. So Part D here, under standard drug design plan, beneficiary pays the $435 deductible and 25% of the drug cost after deductibles are paid. Small co-payment once out of pocket reach $62.50. But remember, the drug plans, they vary so widely over what they'll cover. Some will pay more, some less. It's really, really important when you're searching for your prescription drug plan to understand what medicine you take and what you need for your own health situation. Next slide. So what it covers: hospital 100% on the first 60 days, right? Medical services, remember, it's 80% of the Medicare approved amount. 20% is not, but that's what we get our supplemental plans for. And then, like I said earlier, some preventative services like flu shots, COVID, certain screening, stuff like that. Next slide. Let's cover this real quick because I think this is really important. And again, referencing my mother just because it's personal, but it doesn't cover long-term care. And this is the other one. My mother's from Mexico City. She was born and raised there. And so she always thought if, worst case scenario, she started to run out of money, she just moved back to Mexico with the family there and everything. Here's the problem, and I tell my mother this every day. Yes, you will get your Social Security benefit in Mexico, Mom, but you will not get Medicare coverage. You cannot get care delivered outside of the United States for Medicare. And you'll continue to pay those premiums because it's taken directly out of your Social Security check. So, and this is, again, a personal situation here. I tell my mother all the time, Mom, you go to Mexico, you're going to be paying for health insurance in the United States that you can't use. That doesn't make a lot of sense, okay? Visit Mexico as often as you want, but please get your healthcare coverage here because that's what we do in this country. Like we put money in every year in the form of HI taxes, health insurance taxes, so that you have this coverage when you're in retirement, okay? And then, of course, we all know, or if you don't know, you have Medicare, and then if you get to a level of being impoverished, there's something called Medicaid, right, which in California is Medi-Cal, and that's, that requires a certain, level of income or being below a certain level of income to qualify for that. And that's a totally different discussion. So it doesn't cover, remember, dental care, vision, hearing aids, of course, cosmetic surgery, some of these alternative medicines like acupuncture, stuff like that. Most Medicare plans will not cover that, right? Amounts over the Medicare approved amount and not covered by deductibles or co-insurance. Remember, this again goes back to that public-private partnership that where you really, really have to do your research. Next slide. So what does private insurance cover in full and part? Well, deductibles and co-insurance amounts, that's why we get it. The Part A deductible is big, right? That's one we want covered. Hospital costs after that first 60 days, potentially the 20% of the doctor bills that Medicare doesn't pay, right, over the Medicare approved amount. Maybe even doctor charges over the Medicare approved amount. That's something we definitely want to make sure we know exactly what's being covered and what's not. Amounts the doctor charge over the Medicare approved amount. And then prescription drugs. Sometimes it covers the deductible, not always. Again, which requires research on your part. And most of the cost of certain drugs during the initial benefit period and catastrophic coverage, but not the famous donut hole. Next slide. I'll go over that, what that is in here in a second. So Medigap policies. This is that private insurance. It's a traditional Medicare. It's just a private health insurance for individuals. It's sold by private insurance companies. It supplements Parts A and B, and they have federal laws that were enacted to protect consumers such as yourselves And, each plan has to be a standardized plan of some kind. But again, these are private insurance companies selling these plans, so they change them on a year in, year out basis based on their costs. Next slide. So Medigap insurance company can only sell, like I said, standardized policies. They're identified by letters. They don't work with Medicare Advantage. Remember, Medicare Advantage is that Part C that covers everything. You pay the monthly premium, right? That's something that's going to be out of pocket, and that's what, foreseeably helps you reduce your other costs that we discussed earlier. The costs vary by plan, company, and location. Next slide. These are just an example of all the different types of plan. The most commonly used plan is F, right? But some people want that feel like they're in very, very good health, may not want to pay as much, so they may look at some of the other plans. Next slide. Medicare Advantage. Again, I like to compare this to like a Kaiser plan where pretty much everything's included. You have to stay within the network, right? It's called Medicare Part C. Run by a private company. Again, Medicare pays them out for each member's care. Usually have to use a network doctor or hospital. Usually includes prescription drug plans. That's probably the biggest difference between the traditional Medicare route. And a lot of times people will go with these type of plans because it will include vision or dental or some other type of, preventative care type of things. And I think that's a good thing if it fits for you. A real quick thing to note, Medicare Advantage plans never can exempt somebody because of pre-existing conditions. Never. A Medigap plan or Medicare supplement plan after initial enrollment can. And I said that earlier in the brief. I want to reemphasize that. After initial enrollment, a Medicare supplement plan can deny for pre-existing conditions. Next slide. So shop carefully for your private insurance. Yep, next slide. Let's talk real quick, part 3 here as we get close to 40 minutes after the hour. Let's talk about planning for higher healthcare costs in retirement. Next slide. So out-of-pocket healthcare spending by age and gender here, and this is from the KFF analysis for the Centers of Medicare and Medicaid Services survey 2016. I know, as soon as they come out with a new survey here next year, these costs are going to be significantly higher. Biggest thing to note here is, the average over there on the left is $54.60, right, for men and women. But look at how rapidly the costs increase from your 70s to 85 plus, right? And it really becomes the services, not the premiums, which really requires you to be very diligent about what plan you pick up to supplement your Part A and B. Next slide. So a typical Medicare budget today, and I understand these are figures are a little bit old. I'll get the updated ones for the March presentation. But the Part B premium, $144.60. There's a Medigap premium there, assuming that you decide not to go the Medicare Advantage route. Here's your PDP plan. So per person, $384.60, not including anything with the IRMA. Next slide. So let's take that and multiply that by 12. You can see that's $46.15 annually. Here's your prescription drug, out-of-pocket costs, dental, vision, alternative care. You can see quickly a Medicare beneficiary, right? Everyone thinks, well, Medicare is free. Well, yes, parts of it are, but you have to understand the out-of-pocket costs. More likely than not, it's going to be somewhere between $7,000 and $10,000 a year annually per person of a couple, right? So think about that when it comes to financial planning, when it comes to IRA withdrawals, when it comes to maybe drawing down that HSA to pay for these things. Just remember that this is a significant cost that you need to prepare for in retirement. Something you certainly should have as part of your financial plan if you do one of those. Next slide. So what can cause your healthcare budget to change? Are Medicare premiums tax deductible if you itemize? No, I do not believe so. That's a good question. And I said I don't believe so. I'm 99% on that, Wendy. Good question. You may want to ask your tax advisor, but again, long-term care premiums can be. Thank you, Kathy. Yep, I didn't think they were deductible. Long-term care premiums can be. It's complicated. It's based on adjusted gross income and how the long-term care is paid for and what percentage of AGI it is. Again, that's a tax question that needs to be done with a CPA or an EA. So what can cause your healthcare budget to change in the future? Certainly rising healthcare costs, insurance premiums, out-of-pocket costs, change in the health status. I think this is the number one, right? Expensive prescription drugs, that are not covered, or at least that are significant throughout the year. And then more services not covered by insurance become a larger part. Obviously, the last one there, long-term care, is the big one. Next slide. So again, according to these sources, Fidelity, which everyone's familiar with, and the Employer Research Benefit Institute, you can see there, and these numbers, again, I'm guessing they're 30–40% higher now, but this is how much at the start of retirement to pay for future medical expenses, not including long-term care. So let's just take that lower number, or the higher number there, 301,000. Let's add 30% to that, since this was done, I believe, in 2018, 2019, and go, all right, now we're looking at roughly 400,000 in retirement. So if you say, well, I have an IRA, it's 500,000, it should cover that. Well, no, it won't, because you have to think of ordinary income tax that you're going to pay out of the IRA, especially if you're in California. It's going to cut that IRA down from 500,000 to significantly less than 400,000. This is why we invest. This is why we put money to work, and this is why we try to drag out those withdrawals over time. It's also why we maximize the Social Security benefit. All right, next slide. The plan for long-term care, remember, it's not covered by Medicare, Medigap after the 100th day, and you have to be improving. That's why the average is 28 days, not 100, because you can't sit there for 100 days if you're not improving or you continue to deteriorate. Doctors say, Ryan's not getting any better. It's time he move to a long-term care facility. That is not covered by Medicare. There's no coverage at all for help with activities of daily living. Next slide. So I think this is the part that Suzanne starts to really not like. 35% of people over age 65 have activity limitations, right? You can see what they are. Predominantly ambulatory difficulty would be number one after age 65. Next slide. So what are the causes of activity of daily limitation? Well, I tell you right now, do you guys know what the number one cause of a long-term care event is? Anyone want to venture a guess? Number one cause of a long-term care event. When I say a long-term care event, it takes someone from living an independent life to where 2 of the 6 activities of daily living they cannot.
Falling.
Yeah,
that's exactly right. Excellent answers. A fall. That is exactly right. It's the number one cause of a long-term care event outside of cognitive stuff, right? So a fall. And the research says, we don't know if it's because the bones become too brittle and then they fall, right? The hip is broken or something like that, or if it's just the fall itself. But that is the number one source of a long-term care event for seniors. Next slide. So again, another depressing slide here. Don't need help now, just wait. You can see how rapidly, you look at walking right there, it goes, from age 65 to 74, and it nearly quadruples by the time 85 comes around, right? So, we may be healthy today, but we need to look and think out 20, 25 years from now. And that's what we're really focused on when we look at long-term care. Next slide. I'm not going to go over too much of this levels of long-term care because I know you guys have a separate presentation. So let's skip this slide. Custodial care, you get all this stuff. Skip this one here too. We're going to jump forward a couple here. Everyone's probably familiar with skilled nursing care. So let's just look at some costs. And again, this is 2019. This is a couple of years ago. You can probably take these numbers and add 20%. But the U.S. median cost, and here in California, are we usually the median, or we're a little higher than everybody else? I think we all know that answer, right? We're a little higher normally than everybody else. But you can see a private room in a nursing home almost $300 a day. I would bet that it's well over $300 a day in California, approaching $400 a day, probably here in California. If you just do the math, that's $12,000 a month. That's pretty substantial, right? And so that's a private room in a nursing home. But what about a semi-private room in a nursing home? $247 a day. Assisted living facility, $133 a day. So again, it's not to depress you. It's to get you thinking about and having that discussion with your family. What does that look like in your future? Some of you on this presentation have enough money set aside. That's not going to be a problem. Self-insure. Maybe you have a home that's paid off that's worth $1 million or more. That can be a source of long-term care payments if needed, right? Again, it's about having a plan, having a discussion about it. Next slide. So number one is what I'm going through right now, with my mother not having done the planning that we encouraged her to do. But the way I discuss this with my clients is I just say, your kids, when and if the demise ever comes around, most likely will be at a time when they have their children in school. I have two daughters, 6 and 4, and it's exactly what's happening to us. And my sister just had her first child at age 42, a little girl as well. And so she has a 6-month-old. I have a 6 and a 4-year-old. And, now we're really spending a lot of time and money out of our own pockets taking care of a 71-year-old. And so that's not a situation you want to be in or put your children or grandchildren through. And so I encourage you, again, just to have that conversation and have a plan. It doesn't mean you have to buy long-term care insurance. It just means that you have some type of plan. Next slide. The 3 reminders, next slide. Enroll Medicare on time. I think I hit that one. Then number 2, shop carefully for your private insurance to go with Medicare. Don't forget about the IRMA and large capital gains and how they can affect your Medicare premiums in the future for Part B and Part D. Next slide. And 3, plan for higher healthcare costs in retirement, especially now in this inflationary environment. Yes, we're going to get a nice bump in the Social Security benefits, but I'm pretty sure everybody on here's accounts and portfolios are probably down equivalent of the increase in Social Security. So, 6 in one hand and half the what do they say? What the Lord giveth, He taketh away. It seems like that's what's happening to this year in the market, right? Next slide. Thank you, everyone. I appreciate it. Suzanne, I know how much you love this presentation. 13 minutes earlier, and I'm off to 1 o'clock. I'll wait here for a couple of seconds, see if there's any questions. If not, I'm going to get to my 1 o'clock.
Thank you, Ryan. Fabulous as always. I do have a quick question for you in regards to Medigap and pre-existing conditions. Does it apply? So when you make your first selection of the Medigap program you choose, when you first sign up for all of this, what about the next year in open enrollment if you choose to make a change? Does the pre-existing conditions thing then apply, or are you always exempt?
Yeah, that's a great question, Suzanne. So real quickly, Medicare Advantage never can exclude for pre-existing conditions, right? So, and your question, I know, addresses Medicare supplement or a Medigap policy. It is individualized to each policy, and that's a question in an initial enrollment I would ask, because if you're going to sign up for a policy that you want to be on, they always next year can make the premiums unaffordable, right? Or, raise them substantially so it doesn't make sense for you financially. You need to ask, what pre-existing conditions are you currently excluding from? And I think that will give you a good idea of whether or not that's something that you want to go that route or not.
Okay.
Thank you for that question, though. That's good. Thank you, everyone, for such your kind words in the chat there. How does my choice of plan affect my spouse? Do we both have to choose the same plan? Elizabeth, great question. No, absolutely not. I'm sure there's discounts for couples going on the same plan, but no, you do not have to have the same plan.
And one more question for you, Ryan. For the IRMA, for when you're planning to sell your home, can you let Social Security know in advance, or you wait until after the sale, or what's the strategy?
So, great question. And let me be clear. What Medicare does is they look back, and I see Chris nodding up and down because I know we've had this conversation so many times. They look 2 years prior, right? Because, for example, Medicare isn't determining the cost of a premium based on this year's tax return for next year because, for example, I just filed my tax returns, right? So they go back to the previous year and then attach it 2 years later. What you can do is I could take this year's tax, let's say in 20, I just filed 2021. So let's say 2020, I made $1 million, right? And so I have a very, very high IRMA coming my way. But in 2021, and I had $1 million of income because I sold a home. I really made $200,000, let's say, but I had an $800,000 gain in my home. So my income, shows $1 million, right? My modified adjusted gross income. So what I can do is take my 2021 return, right? Where I show that my income is, 150, 200,000, take that to Social Security Administration, and they will then use that. They automatically use, Chris says, for me, the sale of real estate was my parents' home, and I had to pay the full IRMA. There are exceptions if you sell your own home. Yes, thank you, Chris. Great information there. Yep. Yeah, exactly, because that was an inheritance versus a primary residence. Yeah, exactly right. So again, there's some complicated rules around it, but when it comes to the IRMA, if it was more than 2 years prior, then yes. It's hard to prove in the current year that your income is less than 2 years and completed. They're not going to take your word for it on 2022. So, is there some way to compare our current numbers? I'm sorry?
If I could just quickly jump in, for those who are joining us today who are not members of the Retirement Association, you can go to our YouTube channel. Just go to YouTube and type in the search box, UCSD Retirement Association. And when you click on then the playlist for financial seminars, you will see this seminar and all of our prior financial seminars. You also want to click on the list for senior seminars, and you will see all of those seminars there that might be helpful to you, including our one on Medicare and UCSD healthcare plans. That's for people who are not members. For those of you who are members, the announcement of this video, along with the link to that that video on UCSD plans and Medicare, that will be coming out to you later this week.
Yes. I want to thank everyone again for joining these presentations. I did see one question here from Eva saying, is there an expert I could speak to? And I would please contact Suzanne Chaffee. She can put you in contact with the experts at UCSD. I'm actually just here. I don't sell Medicare insurance. I don't do Medicare insurance. I'm just here to provide information to my wonderful constituents here at the UCSD RRC and Suzanne. So hopefully all of you enjoyed it. Obviously review it on YouTube if you'd like. And I will be here on Friday, right, Suzanne, or is it Thursday?
Yep, it's Friday. Thank you so much, Ryan.
See everyone on Friday
for
part 2. All right.
All right.
Bye,
We'll
everyone.
see you soon. Bye-bye. Thank you, everybody.